So today we're going to go over how to put on a double upright knee brace. So whether we're fitting you with an Össur, DonJoy, Breg, a custom one that we've made in-house, if it has 2 uprights and 4 straps in the back, they kind of all go on the same. So you can use this for any of those really. So we're going to position the brace on the leg. So starting with the knee bent, basically you want to get the knee joints lined up with the center of your knee. So you can use your kneecap as a guide. The way I kind of like to tell people to make sure it's high enough is your top calf strap here. That's going to be your strap number 1 that you always do up first. Basically the top of this strap, when your knee's bent like this, should be touching the back of your thigh. So basically it's as high up on your calf as possible. So that's strap number 1. And in terms of keeping a knee brace on, this is going to be the primary strap that holds it in place. All the other straps just kind of hold the frame against your leg. This is the one that's going to keep the brace up on your leg. Okay, so that's strap number 1. Strap number 2 is the bottom calf strap. So usually the way we work is we work closest to the knee, work our way down, and then we go up here, work close to the knee, work our way up. So strap number 2, the lower calf strap. This one you just want comfortably snug. If you get this one too tight, because it sits right over the muscle belly, it can cause some muscle cramping and stuff if you're doing any sort of running or high activity stuff. So just comfortably tight on that one. Then from here, what you're going to do is you're going to straighten your leg out, get this thigh section back. We're going to have Emily slide forward a bit on the bed. And then strap number 3, again, we're going to work closest to the knee. Before you do this strap up though, I kind of recommend you just kind of pull your thigh tissue through the brace a little bit. And that's going to help position the knee joint a little bit as well. So this one, if we're dealing with an ACL strain, this one needs to be pretty snug as well. Because one of the things we want to avoid is that femur sliding backwards compared to the tibia. So this one needs to be snug to prevent that from happening. And strap number 4, top thigh strap, just needs to be comfortably snug. Sometimes people will do this one up too tight, and because our legs are kind of shaped like funnels, if this is done up too tight, it'll actually force the brace down. So just comfortably snug on that thigh strap. And then finally, if your brace has a strap in the front here, sometimes there's one strap, sometimes there's one down here below the knee, sometimes there's one above. So these are usually the last 2 that we do. Basically what you want to snug this up so then the joints end up in the middle of your knee. Well, that'll be number 5. Lots of times I tell people once we've done this up at the fitting appointment, they don't even really need to adjust this strap anymore. Just leave it in place and just worry about the back 4 straps. If you have a PCL injury and you have a 6 strap here, then that one gets done up quite tight, and again, usually you can leave that one in place as well. So we usually do a little tug test to make sure, and even with Emily's pants, that's staying in place pretty good. So that's how you put it on. As far as washing these guys go, depending on the brace, if you have removable pads, you can just peel those pads out, hand wash them with soap and water, just a mild soap. No detergent, like laundry detergent, and then just make sure you rinse it really well and then let air dry. If you have a padding that's glued in place, what we recommend is you can just, again, wash it with soap and water, or you can use like Lysol wipes or whatever to wipe down the inside of the brace, and again, just let air dry. And that's it.